Today we are going to learn something about elbow dislocation. Elbow dislocations are the second most common major joint dislocations that are seen in the adult age group, and they are the most commonly dislocated joints in children. They account for about 10 to 25% of injuries to the elbow. Also, posterolateral is the most common type of elbow dislocation that we see. Elbow dislocations can be classified as either simple or complex. Simple elbow dislocations are those dislocations which are not associated with any fracture, and if the elbow dislocation is associated with any fracture, it is called as a complex elbow dislocation. We had a 38-year-old female who had a fall on an outstretched hand with trauma to the right dominant elbow around 3 hours back. She presented to the emergency room with swelling, pain, deformity, and inability to move the elbow joint. This is the X-ray of the same patient, showing the anterior-posterior and the lateral views of the elbow joint. Here we can see in the anterior-posterior view there is a medial displacement, and in the lateral view there is a posterior displacement. Hence, it is a simple dislocation, and because of the displacements, it is a posterior-medial elbow dislocation. This is the patient with a deformity in her right dominant elbow. You can see there's a lot of swelling on the medial side, and before we attempt the reduction, we have to check the neurovascular status. The patient is able to make a fist, and also we have to check the radial pulse, because in some elbow dislocation there can be injury to the brachial artery. Here the pulse was palpable in this patient. Now I shall be demonstrating Main and Quigley's method of reducing an elbow dislocation. Here the patient is positioned in prone position with the affected limb dangling over the edge of the bed towards the floor. The wrist is grasped and a gentle traction is applied in the direction of long axis of the forearm. Once muscular relaxation occurs, the olecranon is grasped and is guided into a reduced position without force. Here I have kept the patient in prone position with the affected limb dangling over the edge of the bed. I'll be requiring an assistant to do the reduction. My assistant is going to make a fist and keep that fist above the elbow joint, giving a counter traction, while I'm holding the wrist of the affected side and give a longitudinal traction along the long axis of the forearm. While giving the traction, my thumb of the left hand, as you can see here in the video, is guiding the olecranon into the joint. Once the reduction happens, a clunk is heard and immediately the patient becomes pain-free and comfortable. Now the elbow is kept in a flexed position, and once the patient is made to sit comfortably, I am gently doing a gentle range of motion, flexion and extension of the elbow joint, stabilizing the elbow with my left hand. Here I could not do the valgus and the varus stress test because it was very painful for the patient. I'll be attempting to do the valgus and the varus stress test after a couple of days once the pain settles. Now I'll be immobilizing the elbow joint by putting a above elbow POP slab, a back slab, and I'll be immobilizing the elbow for 10 to 14 days. Before that, at around 4 to 5 days, I'll remove the slab and do a valgus and varus stress test. Here my assistant is applying a cotton roll over the arm and the elbow before application of the POP back slab. Here, as you saw, I didn't use any sort of anesthesia while attempting the elbow dislocation. After doing the elbow dislocation, we have to again check for the neurovascular status. The patient is able to make a fist, and also I was able to palpate the pulse. Here I am applying an above elbow POP back slab and securing it with a roll bandage. I am intending to keep the above elbow POP slab for a minimum of 10 to 14 days. The patient has also been given a cuff collar sling to keep the limb elevated, and after this reduction the patient was sent for a check X-ray, and this is the post reduction check X-ray which shows a concentric reduction of the elbow joint.